I'm Dr. Rajani, and today I'm talking about 5 lab tests that you need to know about and take responsibility for that just aren't getting ordered. And these are my patients coming back to me saying, hey, I didn't get that. Oh, I didn't get that. I saw your video on this. But their doctor either just didn't talk to them about it or actually wouldn't order it for them. We must keep in mind that your general practitioners these days are acting like gatekeepers. They're doing what's recommended for the general population, not necessarily what's exactly right for you, given your history, lifestyle, activities, family history. You need designer medicine now, and more we're looking right directly at your genes to see exactly what's right for you, given the illnesses that potentially are coming forward many years down the road. Prevention is way better than cure, and that's what this video is all about. What am I talking about? Number one, let's talk about hormone replacement therapy. One of the top ones, because I'm dealing with women all day long. They come and say, well, they refuse to order it for me. If you're a woman, the things you want to consider are estrogen, progesterone, total estradiol, LH, FSH, and DHEA, just to name a few. But understand that a woman might go into menopause. I'm seeing low estrogen levels in the mid to late 30s, but let's just take the age of 50. Quite possible you're going to live to 100, and you're perimenopausal 45 to 50. That means you might go half of your life without hormones. I have a whole video on hormones for females. It's worth watching, but that's a test to consider. If you're a male, think testosterone. I think it's a good idea to get a baseline in your 30s, but by mid 40s to 50s, you want to think about not just a screening total, but also a free, because there's something called sex hormone binding globulin, and that will bind to your testosterone and partake in the total. So you want to think about a panel if you're a male as well, not just the screening tests that you might get ordered for you. The time of the day is something else to consider, and when you're getting these in relation to sexual activity and so on. But one of the top ones that people never get for wellness. Keep in mind there's a lot you can do naturally to help boost your testosterone, from foods. Just breathing through your nose has been shown to increase growth hormone. Exercise, increasing muscle mass. Sexual activity, if you don't use it, you certainly lose it. Foods, ashwagandha, tongkat ali. There's all kinds of things that you can do that are natural. Doesn't mean you have to go on hormones, but you want to be aware of what might be causing your symptoms. Number 2 is a simple UA, a urinalysis, microscopically looking at a urine sample. Now this is inexpensive, under 10 bucks or so, but people come back and they don't get it and their doctor won't order it. Think about it. Simply finding red cells in the urine could indicate a renal cell carcinoma or a cancer in the kidney, and the blood, a little bit of blood shows a precursor to what could be coming. Many things can cause blood in the urine, but for under $10 test, there's some other things you can find out. That's your filtration system in the body. You should know what you're filtering. I had a case of a gentleman, this was many years ago, he was 50. He had it as part of a screening test for the state. It was in Canada for part of the provincial screening. He worked for the medical system, and they just did these. And there were 3 red cells in the urine. Okay, let's repeat that. Repeat it, nothing, no red cells. I was still pretty suspicious. Let's repeat it one more time, because that you could pick something up that's important. 20 red blood cells. Come to find out, renal cell carcinoma. He's alive to this day. It's like 25, 35 years ago. And that's a deadly cancer. So a simple UA, inexpensive, you want to consider it. Number 3, you want to consider this, a lot of stigma around it, and it's your digestive tract. And what I'm thinking is colon cancer, and the gold standard is colonoscopy. Put a scope up and you look. Now, a lot of people don't want to have that test. I've had 2 already. It's not a big deal. But if you don't want to have it, there's other things you can do. a simple piece of paper. You can check for blood in the stool with you take a piece of paper, put a little stool sample on it, and there's a reagent they use, and it will light up if there's blood. That shows that maybe there's a cancer. The other thing that's really cool that I like is something called Cologuard. By the way, I get paid nothing for this. There's no affiliate links. But called Cologuard, and it detects 92% of cancers, and what it looks for is DNA. As the stool's going down, if there's a cancer, it will smudge off a little DNA, and you see the DNA from a cancer cell. And it also looks for red blood cells or blood in the stool, which would indicate a problem. But if you don't want to have a colonoscopy because you're worried about the test or there's a stigma around it, there are things you can do that are much less invasive, and 92% is a pretty good number. So that's something you want to look into. Number 4, vitamin D. No one's checking vitamin D levels, even though it's been in the news for the past 4 years, of course. Vitamin D helps your immune system, but also all-cause mortality. And I highlighted that in a video a few months ago where it's been shown that people with lower levels of vitamin D don't live as long. Because if you get sick or ill, for instance, and you have low vitamin D levels, your immune system's down. Also, to keep in mind that cancer a lot of times is an immune system problem. A weak immunity doesn't fight off those aberrant cells that are formed. So checking your vitamin D, what's a level that you want to look for? 20 to 50 nanograms, 20 to 40 is accepted, nanograms per ml. There's a lot of people who are in the know that want to run between 40 to 100, but in terms of dosing of supplements, some people, because your doctor typically won't measure it for you. Now you can get these tests on your own. You can do these at home. If you want to know about these home tests, let me know in the comments below. I'll start to put links to these tests. But there are people just run their supplements and don't test their levels. If you're running a supplement, you're thinking 5 to 10,000 international units a day. The recommended level is about 600 to 1,000 international units a day. Most people in the know are running at least 5 to 10,000 international units of vitamin D. My K2D3, for example, has 100 micrograms of K2. The D level in there is 5,000 international units, and that's what I take daily. Finally, TSH, particularly for women. They're more affected by this. How many women come in and they say, hey, I'm tired, don't quite feel myself, maybe irregular periods, dry skin. Of course, I'm seeing skin all day long, dry skin. Not quite themselves. The thyroid's like the regulator in your car or the idler in the car. And if it's running a little low, you're sluggish. But here's the problem. A lot of people, the screening test is a TSH. That's not good enough. That won't pick up the majority of them, and 10% of women are affected by this. That's a high number. So when you're thinking about getting your thyroid test, think about TSH, a good screening test. You also want to think about T3, T4, reverse T3, antithyroid globulin, and thyroid peroxidase antibodies. You want to look for antibodies that are affecting the thyroid and thyroid production. So it's complex. Each of those are beyond the discussion of exactly what to get and what the tests mean. But just understand that you want to take care of your health. You're responsible, and the healthcare system that we have today is not looking out necessarily for your best interest, but for the general population. And these things cost money, and often medical systems do not want to pay for that. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.